Hello, I'm Westland Mayor William Wild with an update on the coronavirus, COVID-19, and what it means for Westland residents. Joining me today is our Fire Chief Mike Stradtner and Westland City Council President Jim Hart. We're going to use this opportunity to give you a short overview of the virus, including symptoms and how it is spread. Chief Stradtner will also outline the best practices we can all do to prevent the spread of COVID-19 and what to do if you feel like you may be infected. Council President Hart will then go over some of the recommendations from the CDC and Governor Whitmer and talk about what types of businesses are closing as a precaution and what other restrictions have been put in place. And then I'll be back to talk about what steps the City of Westland has taken to this point and where we go from here. I've appointed Fire Chief Mike Stradtner as Westland's COVID-19 Emergency Preparedness Coordinator, and I'm going to have him open up today's update. Chief?
Hello, I'm City of Westland Fire Chief Mike Stradtner. I want to discuss some of the COVID-19 symptoms and what to look out for and some commonly asked questions and frequently sought after information. Some of the common symptoms associated with COVID-19 are a fever. Typically CDC recommends anything over 100.4 should be looked at, dry cough for several days, and difficulty breathing. What we've learned about the virus is that it spreads very easily throughout the community from person to person. The virus is spread between two people who are in close contact with each other, typically within 6 feet from one another, or through respiratory droplets when an infected person coughs or sneezes. Someone who is actively sick with COVID-19 can spread the illness to others, as we've learned. That is why the CDC recommends that these patients be isolated in either the hospital or at home, depending on how sick they are, until they are better and no longer pose a risk of infecting others. How long someone is actively sick can vary, so the decision on when to release someone from isolation or quarantine is made on a case-by-case basis with consultation from your doctors. What are some of the things that we can do to prevent this? Well, many of the prevention techniques are similar to like flu-like symptoms that we deal with every season. But most important is if you are sick, please stay home. Try to wash your hands thoroughly for at least 20 seconds. Avoid touching your face, eyes, or mouth with unwashed hands. Cover your cough or sneeze and cover it into your arm, not your hands. Avoid contact with other people. Regularly clean and disinfect surfaces. One of the common questions is, often people question why so many measures are being taken to limit the number of people in place, or closing schools and a variety of other measures that cause some significant challenges for us. But remember, these are temporary significant challenges. The concept is to limit the exposure rate by what is called flattening the curve, as to not overwhelm the healthcare system. The term social distancing helps to slow the spread of a virus and helps to flatten the curve necessary so healthcare systems are not overwhelmed and proper care can take place in both the pre-hospital and hospital setting. Often the question is asked, how do I get tested? Several healthcare facilities now offer drive-up testing, and tests are limited to people that may display symptoms associated with COVID-19. You can contact your healthcare provider to discuss your symptoms. Please do not show up at your doctor's office or at local hospitals if you feel you are exposed or have symptoms of COVID-19 without making a phone call first. This allows hospitals to make proper, safe arrangements for you and those around you. Or you can contact your local health department to inquire about testing. It is important to remember that these tests are in demand, and you may not be tested unless your symptoms are consistent with COVID-19. There are several options out there to stay informed about COVID-19. We've provided you with some examples, but there are numerous others. I would just encourage you to rely on reliable information, which can be found at thecityofwestland.com, the Michigan coronavirus website at michigan.gov, coronavirus, the CDC's coronavirus website. There are also several hotlines that you can call that are available 7 days a week. The Michigan COVID hotline, the Wayne County COVID hotline, Westland has a COVID hotline, Beaumont Health and many other healthcare facilities have COVID hotlines, and many of these options offer medical professionals that are trained to answer any concerns that you may have. When we think about the 911 system, we have to think about our first responders, for our firefighters, police officers, and EMS workers. Please remember that if you are sick and you need to call 911, that call takers from 911 dispatch centers are asking pre-screening questions to determine exposure risks for our responding crews so they can better be able to protect themselves and their families. We understand that in emergencies, the last thing we want to do is answer excessive questions, but doing so will keep us all safe. Some of the more frequently asked questions about is, will warm weather stop the outbreak of this COVID-19, which we know other flu-like viruses are cold weather dependent. It's not yet known whether weather and temperature impact the spread of COVID-19. Some other viruses, like the common cold and flu, spread more during cold weather months, but that does not mean it is impossible to become sick with these viruses during other months. At this time, it is not known whether the spread of COVID-19 will decrease when warmer weather arrives. There is much more to learn about the transmittability, severity, and other features associated with COVID-19, and investigations are ongoing. Should I be tested for COVID-19? If you develop signs and symptoms such as a fever, cough, and/or difficulty breathing, and have been in close contact with any person known to have COVID-19, or have recently traveled from an area with ongoing spread of COVID-19, stay home and call your healthcare provider. Older patients and individuals who have severe underlying medical conditions or are immunocompromised should contact their healthcare provider early, even if their illness is mild. If you have severe symptoms, such as persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face, contact your healthcare provider or emergency room and seek care immediately. Your doctor will determine if you have signs and symptoms of COVID-19 and whether or not you should be tested. In addition to the many things that we have listed, as people want to know, is what can I do if I have a question? You can call the number of hotline that we provided for you. You can call the Wayne County Department of Health COVID-19 informational hotline, and they'll address all your concerns. Thank you. Mayor?
Thank you, Chief Stradtner. Next, I'd like to ask City Council President Jim Hart to step forward.
Thank you, Mayor. Things are changing constantly with a number of cases here in Michigan, and so we're closely monitoring the situation. The City of Westland is also working closely with the state and county officials to make sure we're doing everything we can to keep our residents safe. That includes following the executive orders that the governor has issued. On March 12th, the governor signed the order to cancel or postpone all events of over 250 people statewide, effective immediately and ending on April 5th. That order also closed all K-12 school buildings to students. Governor Whitmer expanded the restrictions to include bars and restaurants. Dining establishments are permitted to offer carry-out and delivery services. This latest order also closes gyms, fitness centers, casinos, cigar bars, movie theaters, and indoor or outdoor performance venues. These restrictions are in effect until March 30th. This does not include grocery stores, markets, convenience stores, pharmacies, drugstores, or food pantries. They are permitted to operate as they have normally been, although many stores have changed their hours to allow more time for restocking shelves and deeper cleaning and sanitizing. The CDC has further recommended that large events and mass gatherings, even those planned by individuals as opposed to organizations, be postponed. This would include conferences, assemblies, weddings, and other such events. I know that's a long list of events and places that are temporarily off limits. The key word there is temporary. The hope is that this time away from large gatherings or places where the virus could easily spread will bring us closer to the end of the outbreak. By all of us cooperating and adhering to the guidelines, we will all be able to get back to our normal habits and hang out sooner than later. Thank you. Mayor?
Thank you, Council President. With all of the precautions that are recommended, you may be asking, well, what about doing business with the city? What happens if I come into City Hall? First of all, we're following all the recommendations of the CDC and Governor Whitmer and encouraging everyone to limit person-to-person contact as much as possible. We've been working to make it easier to complete business with the City of Westland without you having to physically come to City Hall. Our website is prepared to allow you to complete many tasks and transactions from the comfort of your own home. By visiting cityofwestland.com, you can fill requests with the building and planning departments, including paying for payments and inspections right from the site. The city clerk's office also has a variety of online offerings and downloads. The finance page on our site allows you to review water and tax billing information, as well as pay your bills online. We've also added a drop box to the front of City Hall that allows you to make payments without having to physically come into the building. It's a white box. It's right next to the post office box at the far end of the parking lot. The Departments of Public Service and Neighborhood Services have always given residents the opportunity to report issues around the city that need addressed, such as blight or potholes, or to request a special pickup on trash day. These services and many more are available by going to thecityofwestland.com. That is also your source to get the latest and most local information on the COVID-19 outbreak. We added direct links to the CDC and the State of Michigan websites as well. Our social media platforms are another great source that will be used to get new information out to you as soon as it's available. These are unprecedented times in our history as a city and as a nation. Situations like this can bring out the worst in people, but it also gives each of us the opportunity to show how good we can be. We like to say that Westland is a compassionate city, and in the coming days and weeks, we're going to have a chance to live that out. You can follow the guidelines and still check on your family, friends, and neighbors. Just because you're practicing social distancing, it doesn't mean you can't share a smile or still be kind to one another. A lot of people are very stressed and anxious right now with so much uncertainty going on. But what is certain is that Westland is a great community filled with wonderful and resilient people. We will carry on and we will see this challenge through. So continue to live your life, follow the recommendations the best that you can, and know that we'll be back with more updates as soon as information becomes available. And once again, you can always visit thecityofwestland.com for the latest information, as well as check out all the city's social media platforms. And of course, be sure to stay tuned to WLND, Facebook, and our YouTube channel for further updates.